Okay, so let's take a look at the elements of diagnosis from subsection of use of the manual. All right, so a couple things, and you'll see this in different areas of the DSM that oftentimes we're not going to get a perfect fit diagnosis, meaning, oh, I've got all the criteria checked, or even the minimum criteria checked a lot of times, at least not initially. One of the things I wanted to mention about as we look at the use, both the use of other specified and unspecified as indicators of current uncertainty about the diagnosis, or we are establishing that diagnosis, believe we established that diagnosis, but not with a level of specificity that we think we can get to, depending on how much data we have. And one of the things I wanted to mention about that, having the benefit of having experienced in sort of a full spectrum, or at least a wide spectrum of levels of care, from crisis center, emergency room kind of stuff, inpatient, to to working in my own private practice, and everything, lots of different healthcare settings in between, is that the amount of time you get with a client is highly variable across those settings, and that will influence your ability to get enough data to render full diagnoses, and your use of other specified or unspecified, as well as being able to drill deeper into specifiers and subtypes within a diagnosis when it's available to you in the DSM, can be highly dependent on the setting that you're working in. Right. And so, when I've, like I said, having experienced both ends of the healthcare spectrum in that way, I really get a good sense of that. So, when you're in, more acute care settings and emergency settings and crisis response settings, where you likely get less time with any client, and oftentimes your encounter with that client is going to be a singular, meaning you won't see that client again, likely. And I don't want you to get frustrated, because, and just like with these, with the case studies, the virtual case studies that we're going to do together, you're getting a snippet of data, and not what you would get in a full hour session. And a lot of times for me in private practice, I'm going to take multiple, if it's available to me and to the client, and the client's interested, I'm going to take multiple sessions to really get to, okay, I think I have all the data I need to really finalize this diagnosis, and complete that case formulation process of getting the data that I need, sufficient amount of data I need for diagnosis. What I feel is that, is a thoughtful, methodically arrived diagnosis, factoring all the circumstances of their life that they've shared, and identity stuff that they've shared, or as applicable, and then creating a truly customized, tailored intervention plan or treatment plan for that individual or family or couple. Okay. Subtypes and specifiers, that can definitely get confusing for people. Whenever, when I'm teaching the class, it's something that's been comes up almost every time I teach it. Just it's the way it's laid out in the DSM often isn't super clear to people. So if it's not to you, don't feel bad about it. A few years ago, I started using and went out and try to do some research, find some graphics that, as you see here, that I thought would be helpful, and sort of just making sure you have your head around the difference between subtypes and specifiers. And when you're looking at the DSM, or when you're looking at criteria in the DSM, one sort of easy way to remember, you talk about subtype specifier, is in the DSM, you'll see that specify whether, or specify if. Okay. So take a look at those, and of course, let me know if you have questions about them. But hopefully, that'll get you in a place where you feel comfortable with the subtypes and specifiers and what they are. So here's a little bit more from the text about other specified and unspecified that you can read. But in talking about at the beginning of the video, that was just the one thing I wanted to add to it. So, so some a little bit more context on elements of the diagnosis.